tuberculosis, of course, is still a big theme around the world, and every day it's a day with many cases around the world, and every year we celebrate the World Tuberculosis Day. So which are the major point for tuberculosis? I will summarize this here. So there are two extremes. The first one is the pathway, which is dealing with the treatment of latent infection. As you know, most of the cases of TB, active TB, they come from a reactivation of latent cases. So the screening is for patients with basically no symptoms. We can use either...
Hello, Dr.
Yeah.
We can see the slides.
I see. So that
okay,
happened.
Go ahead now. Thank you.
Can you? Can
yes,
you see them now?
Yes, we can see the slides. Thank you.
Okay. So as I told you, the treatment of the screening of latent TB infection is with people with no symptoms, is done with a diagnostic test, can be either the skin test, the tuberculosis skin test, so the MANTU test, or the blood-based interferon gamma release assay. These patients have a normal chest X-ray, no evidence of disease, and you see here the treatment, they range from 1 month to 6 months in duration. On the other opposite, you have the treatment of active disease. And the treatment of active disease is something which is important because there is an active case finding or passive case finding. Active case finding means patient with minimal symptoms. Passive case finding with patient that will come to you unwell. Chest X-ray usually abnormal. We need sampling for detection of TB. When we detect MTB and there is no resistance, we have a course, standard course of 2 months, isoniazid, rifampin, pyrazinamide, and ethambutol, and 4 months of isoniazid and rifampin. Now, but in between these two extremes, there is the management of those individuals that fall in the gap between active and latent treatment, which may lead to over or under treatment, invasive investigation, and loss to follow-up. And these will be patients in which MTB is not detected. So this is still one missing point, and we have a spectrum of TB, which is again going from latent TB infection to subclinical TB disease to active TB disease. Very important to convey the message that TB is a spectrum of different stages of TB, going from asymptomatic to symptomatic, from smear negative to smear positive, normal chest X-ray or abnormal chest X-ray, the identification of the status, and the management approach, which is different. For each of these steps, we also have future approach. They are going from therapeutic vaccination for latent infection to new diagnostics, in particular to identify drug-resistant germs, towards host-directed therapies, which might be important. And you know, there are several clinical trials ongoing on this. But in 2022, it's impossible not to speak about tuberculosis in the context of COVID. And so I will spend the next slides to reasoning with you on which might be the implication of the intersection between these two germs. And there is a very nice review article or editorial that was published end of March by these colleagues, in particular Kert Andeda in South Africa and Madhukar Pai in India and Canada. They really are discussing the intersecting pandemics because TB is one of the pandemics which is ongoing, and COVID-19 is the new pandemic. What happened at the population level, patient level, which is the clinical presentation, and what we need to do. So first, and a phenomenon has been observed worldwide, which is the decrease in the number of TB notifications. So you see on a global level, we go around 6.4, 6.8 million over the last 4 years. And now, 2020, there has been a fall under 6 million. And this is true for both the African region, the Americas, the Southeast region. So this is clearly due to the fact that there is an under attention and under notification of TB cases. And this is particularly true in the high burden countries. You see, less 40% between 2019 and 2020 in the Philippines, less 30% in Indonesia, less 25% in India, 20% down in Russia, and 14% down in China. So what this is improving, which are the effects of this? So what the modeling of TB epidemiology predict is that we will have potentially a rebound effect. So in other words, when the pandemics of COVID-19 will be over in many countries because of vaccination or because of the change in the characteristics of the clinical entity related to SARS-CoV-2, we will probably see a rebound effect. And you see that the data are not available yet, but in particular, look at India, the incident change can be relatively to January 2020, can be 110% more in 2022. And as consequence, the mortality change relatively to January 2020, as you see in India, can be 140% up in 2022. So we need to be prepared for this change. And it's important to realize, and I think this is something that you know very well, but it's very, I think, helpful to stress again, that the transmission of tuberculosis and SARS-CoV-2, they have very high similarities. You know, so they are both transmitted by small aerosol particles. We know that both pathogens can be identified by polymerase chain reaction in room air. We can isolate both M. tuberculosis and SARS-CoV-2 from exhale breath. There is a high risk for household contacts for both pathogens. There is a high risk to healthcare providers, and there is a high risk with proximity to index case. The risk of transmission from a symptomatic case is very high in SARS-CoV-2, is probable in TB, and the risk of transmission outdoor is low for both pathogens. These are both respiratory pathogens, but the risk of transmission indoor is very high. We know that for both pathogens, there is a reduction of risk of transmission by having the patients using the mask. And we also know that both pathogens are probably susceptible to ultraviolet lights, and there are super spreading epidemiology. Now, which are the potential effects of the COVID-19 pandemic on tuberculosis infection burden? These are highlighted here. Mainly, these are related. Can you switch off the microphone, maybe, because it's a little bit of noise for me in the background? Thank you. So the potential effect of the COVID-19 pandemic is mainly related to the area of exposure and susceptibility to TB. So there is a potential for decrease of the burden of tuberculosis by reduction in non-household community-based contact, like reduced congregation, religious, recreational, movie theater, and all of that. We could have a decrease in TB cases by having the healthcare workers and also the general public in some country wearing masks. And at the same time, we can have improved prevention control of infection practices like ventilation and hand hygiene that can reduce the tuberculosis burden. On the opposite side, we also have a potential for increased burden, since there will be higher contact saturation because of the lockdowns that will happen here and there. Let's think of China now. Worsen poverty in many countries, job loss, unemployment, economic burden. There's been already a reduction in HIV control in African countries, reduction in type 2 diabetes control, which are both high risk factor for TB, and potential for co-infection with SARS-CoV-2 and MTB. Also, there is a potential for reduced BCG vaccination rate. So what we know now is that we have strong interaction between TB, HIV, and COVID-19. And now if we look at the patients admitted to hospital with COVID-19, and you see that in the gray circles, you see the total number of patients. Now, about 40% are in the age between 40 and 59%. Many patients will have non-communicable comorbidity, but many patients will also have HIV, or patient will have also active tuberculosis. Now, why this is very important? This is very important because we know that the coexistence of HIV and tuberculosis, which is, as you know, a very frequent event, in particular in Africa, increased by 2 times the risk of death when the patients get infected with SARS-CoV-2. And that risk is increased by 1.4 for both HIV and tuberculosis only. So we need to be aware that in particular in some area of the country, of the world, the interaction between the two pandemics could actually result in an increase in the overall mortality. Now, which are the risks associated with the two pandemics being present at the same time? You know, tuberculosis will induce a decrease of GDP, same as COVID-19, and these will have effect on the marginalization of services because of COVID-19, less healthcare staff for TB services, less access to TB healthcare facility, less capacity for TB diagnostics because we have more COVID-19 diagnostics, less TB support, increased cost of personal protection equipment, reduced access to PPE, increasing the supply chain delays of tuberculosis medication, to give an example, and there will be a disruption of preventive TB services. So there will be marginalization of TB services because of COVID-19. At the same time, there will be societal impact of COVID-19, enhancing the burden. So less HIV and diabetes care, increasing unemployment, increasing psychological distress, or substance abuse. There will also be deleterious macroeconomic impact, less global supply, more disruption in production networks, more shifts in typical consumption demand, and more risk premiums based on vulnerability. This will lead to an increase in tuberculosis burden with catastrophic costs among patients with tuberculosis and decrease of resources for tuberculosis program, increase of poverty, overcrowding, malnutrition. As a final consequence, as you can see here, we might have a huge, significant increase in the number of people dying with tuberculosis worldwide. So now what we need to do quickly, which are the research priorities and which are the major challenges? Let's look at the 3 areas for research priority. Let's say to diagnosis and care. We clearly need to improve both TB and COVID-19 case finding. And in particular, we need to improve case finding of these 2 infectious diseases, in particular in the area where co-infection is very likely and where HIV is also going to be a potential third element. Then, of course, we need to develop more sensitive and more specific point-of-care diagnostics so that we can do cost-effective screening. This is clearly important for TB. We know that. We're knowing that for a long time ago, but also we know that for COVID-19 now. Clearly, the surveillance and the outcome will be two important domains. We need to estimate the prevalence and the effect of SARS-CoV-2 infection on patients with TB. And this is true in any geographical area, both low income, middle income, and high income. And we need to have a precise assessment of long COVID in patients with active and latent TB, I would say. So we need to be careful because these two pandemics clearly interact at the patient level. Then we need to be aware that we need still pandemic preparedness. We need to recognize that many TB drivers also influence TB and COVID, and also explore solutions to vaccine hesitancy for both TB and COVID-19. In the end, among the major challenges that we have in front of us is to really understand and effectively communicate to political decisions the costs of interaction between TB and COVID-19. As a consequence, at the government level, at the international level, we need to increase the funding for both translational and operational research and innovation in these two fields, and in particular, in the field of interaction between COVID-19 and tuberculosis. And with this, I thank you very much for your attention. Happy to take